Well, joining us now is the Federal Health Minister, Mark Holland. Minister, thank you for making the time.
Thanks so much, Michael. Appreciate it.
Listen, I know you want to celebrate the milestones today, but I'm actually going to start here with some of the Conservative response to your news conference today, because the opposition is highlighting, I guess, essentially the shortfalls of the program, in particular that only 30% of oral health care providers have signed up to be a part of the program. It's great to celebrate the 2 million who will now be eligible for care, but how do you ensure that they actually get the care that they're waiting for?
Well, actually, it's closer to 40% now. We've seen in just a few weeks, we've gone from 5,000 providers to nearly 10,000. We have more than 9,700 providers. And then if you actually look at the hygienists and denturists, there's almost full participation. And we're hearing from providers every day how simple it is, how easy it is to use, how pleased they are with the experience, how quickly they're getting paid. So every day those numbers are going up. And this, of course, is all before the new online portal on July 8th. So, the Conservatives are very focused on trying to make this not work, which is very frustrating. I mean, it's one thing to vote against it, but I think it's frankly reprehensible to be out there spreading misinformation and grabbing pom-poms and cheering for people to not get care. We saw, just as an example, in a clinic, Raphael today, talking about just how meaningful it was for him to be able to get oral health care, what kind of difference it's going to make to him and his mouth, and talking to providers about, people not having to wait for emergencies, not having to go into surgical rooms because they've put off dental procedures so long that they're winding up with surgeries. It's fine, they're against it, but to try to spread misinformation and cheer against the plan, I think is not appropriate. Okay,
I'll get back to that in a second. But, Minister, I'm wondering what your goal here is. Is it to get 100% of oral care health providers enrolled? Is it 70, 60? What exactly is the level of buy-in that you need from dentists to make sure that you are keeping your promise to Canadians that they'll get care?
Well, I think we're on our way to get to 100% of dentists. I think we'll get there very, very close. Or at least very close to it. This is the largest federal program launched in Canadian history, and this is totally voluntary on the part of dentists. I think in just a few weeks, for us to already be at nearly 40% of oral health professionals participating is just so exciting. And what does that mean in practical terms, Michael? It means that we're seeing tens of thousands of seniors a week. In just the opening couple of weeks, we've seen over 90,000 seniors. That's a huge, huge number. And when you break that down to what that means for their dignity and about getting care, just as one story in Vanier, a lady finally getting dentures after 41 years of not being able to afford them. She has plastic plates in her mouth that she's crushing food with, finally getting a new pair of dentures. And I think that's the kind of country we want to be in, where somebody like that patient is getting the care they need.
Okay, it's over 90,000, as you say, in a program that's only 3 weeks old. But, I'm wondering, Minister, how equitable has that accomplishment been? Are you talking about bigger provinces where that's been able to be attained, urban versus rural? Where are you seeing the success so far?
Well, what we've seen is that, certain areas, the misinformation has been greater. And so when we get a certain number of providers, then they're able to talk to each other about what a positive experience it is, how little administration it is, how it's actually faster and easier to use than private plans. In many instances, folks are telling us that, so that we then get a positive contagion of providers joining in areas. So, I was out in Atlantic where, there's been, the health critic for the Conservatives has been very active spreading misinformation, countering that, talking about just how positive it is and how well it's working in different areas of the country. So, go and attack that misinformation and really make sure that providers get the chance to talk to other providers who are using this program very, very successfully.
Where's your biggest challenge, though? Atlantic Canada is what, a challenge area, a success area? Where are you finding that you're in this country where there are greater obstacles?
Well, I think that we're finding it's more regional than anything else, and it has to do with the number of providers there. So once we find and this is of course just in a few weeks, but we found once we're able to get that provider number up to 10% of providers within a geographic region, that puts us in a good position to be able to then really get those providers talking, hearing positive experiences, and then we see a real explosion. So I'm going around the country and having conversations directly with dentists and denturists and hygienists, really overcoming some of the misinformation that's being put out there to connect people to the right information and get them using the services and making sure that we get seniors getting the care they need.
Okay, so you're out there talking to different associations, different professionals. What are the outstanding concerns? If you would explain it to Canadians who are not a part of that conversation, what are the outstanding concerns that you find yourself having to explain and talk about time and again?
Well, I think the biggest one is the idea that there's a lot of paperwork or administration, and of course that isn't the case. In fact, I have many providers saying to me once they join the plan, they keep looking for what this paperwork and administration is. They can't find it. So, in making sure that people, and this is what I think is the big deal with July 8th, when providers can interact with the plan on a one-off basis, then they can, even without officially participating, try the plan, see how easy it is. So I think that will overcome it. The other barriers, I think we've largely lifted. I think most of the fears come down to hearing, the Conservatives say that this is going to be a bad experience for people or this is a bad plan. It's overcoming a lot of that kind of partisan silliness, which is very frustrating to have to combat that. But overall, I have to say, it's I was elected 20 years ago, getting a chance to talk to patients, many of whom haven't had oral health care in their lives or in a very long time, and seeing what that means to their sense of dignity, talking to providers about, being able to go to populations of people who, they would wind up in emergency rooms. Now we're able to get them care. I mean, it's extremely heartening. It is incredibly valuable. And I think it's very in line with the Canadian spirit that we believe everybody should be able to get the care that they need. And this was a major, major hole in a public health system that we're filling.
Mm-hmm. I have about a minute left here, Minister, but I do want to ask, because you keep saying that Conservatives are spreading misinformation. You talk about going across the country, but what else will your government have to do to tell Canadians about the program and to sell them on it at this point then, if you keep pointing out the opposition is essentially talking it down to Canadians coast to coast?
Sure. So, in the first order, we're not having any problem with people signing up, and that's fantastic. 2 million seniors have signed up already, and more being added every day. So on the demand side, folks want care. They know they need it. They know it's good for their health, that it's going to prevent bad health outcomes. And so on that side, we're going to keep spreading the message, but it's going very well. And on the provider side, frankly, I'm meeting every single day with oral health professionals. There isn't a day that goes by that I'm not meeting in person or over Zoom or on telephone with oral health providers, getting answers to their questions, fixing any problems that they have, showing them that we are going to be 100% wind in their sails to get this done. And so we always said it would be iterative. This is 9 million people. This is we're talking about tens of thousands of providers. It's a huge undertaking, but like anything big, you take it a step at a time. And in the opening weeks, we've made huge progress. We got a lot more yet to do, and we're going to get it done.
Okay, Minister Mark Holland, thank you again for the time today.
Thanks so much, Mike.